Welcome to this virtual program regarding development and efficacy of the vaccinations of the community of the library and the Alliance for Latino Health. My name is Edgar Hilrico, and I'm the Director of Renovation, and I'm the host tonight. Other members of the National Library of Medicine and the leadership team of the University of Washington and volunteers of the Emory and Baylor colleges. Keep in mind that this event has subtitles available. To have access to this feature on YouTube, please click on the logo SS on the bottom right corner of your screen. If you have any difficulties with the subtitles or any other technical problems, please send us a message through the chat or the conversation feature. At this moment, the entire audience will be in silence, but we thank you for your comments and questions. Through the live broadcast on Facebook, please use the live feature for comments and the chat version. If you are with us through the Facebook live stream, you can also send your comments or concerns through the chat box. During our session of Q&A, we'll attempt to answer most of the questions that we receive. Some of you, when registered, already sent your questions, and we'll try to answer those questions. This virtual of efficacy of the vaccination is being financed by all of us of the National Organizations for Health in the United States. The vision of this program, all of us, is to speed and promote the health in the entire nation, which will allow the investigators to better understand why the sick people stay healthy. To achieve this goal, all of us, Latino, has the main goal of taking all this library to show the diversity of the United States. With the participation of over 1 million volunteers across the country, we'll be able to expand the attention and personalized attention to all of us. Today, we invite you to learn more about this program by visiting joinallofus.org/BNM for Spanish or joinallofus.org/NLM for English. Tonight, it is my pleasure to introduce 5 Latino women professionals in the medicine area and public health. Our first panelist is Dr. Susan Holacek, is a lecturer in the School of Life Sciences in Arizona State University and co-director of the School of Life Sciences undergraduate research at that university. Our second panelist, which is with us tonight, is Dr. Leila E. Wack-Colburn. She is an associate professor at the Emory University School of Medicine, medical director for outpatient parental and antibiotics, and orthopedic infectious diseases program director also in Emory Healthcare. Our third panelist for tonight is Dr. Paulina Rebolledo, assistant professor of medicine and global health at the University of Emory, also in the Rollins School of Public Health. Also from Emory School, we have Dr. Lorena Valeria Cantos, who is assistant professor at the Division of Infectious Diseases at the Emory University School of Medicine. And our final panelist is Dr. Kenya Pujols, who is senior clinical research coordinator for the Institute for Genomic Medicine at the Columbia University Irving Medical Center. Welcome to all of our panelists, and thank you for participating tonight. This event is going to be split in 2 sessions. During the first session, each panelist will have 5 minutes to make a presentation on their own subject. In the last session, we'll answer the questions received and we'll have a conversation. Our panelists will take us from the origin of the vaccines to the importance for people to receive this. And for this, we'll start with Dr. Suzanne, who will start telling us about the origin of the vaccines. So, Susan, welcome for being here tonight.
Thank you. It's a pleasure to be with all of you. But before I start talking about the vaccine, I believe that it's important to talk about the immune system. Here is a Latin can with 3 lines of defense. The first line of defense is the physical barriers, and those are composed by our skin and the mucus. The second line of defense, we have the cells and that are going to destroy any invader. And the third line of defense is a little bit more specific. This is going to attack the pathogens and in a very specific way. Here we have our B and our T lymphocytes. And these are very important, especially when we talk about vaccines, because the B lymphocytes, they're going to produce the antibodies that we need so much to neutralize the pathogens. Unfortunately, our immune system does not work 100% correctly. And that's how we have all these diseases. Next slide. Let's talk about epidemics. We have to think about a number, and it is our basic reproduction number. Maybe you heard during the initial stages of COVID, many countries were trying to this number, and there are many articles that were published, and it was decided that it was between 2 and 6. And it depends a lot in the areas of where the people are infected. It's not an exact number, but there's going to be a range. And it is according to the type of transmission and the type of contact that people have. In this case, with this slide, you can see that you have a basic number of 2. We start with generation 0, that is patient 0, the first person that became infected with the virus. And this person is going to impact 2 other people. So then we have 2 other patients in red that contracted the disease, and each one of them is going to also have contact with 2 other people. Let's say that this is COVID. This means that per each person that has the disease, 2 others are going to have it as well. This is not an exact number for every country, because if we start to think, the way that we contact other people is very different from country to country. In Latin countries, we love to hug people, we love to kiss each other when we say hello to each other, and that could have a larger contribution in the spread of the virus. When we go to other places in the world where the conversation is established is very different, things change. This is something that is happening worldwide. And this is we're traveling through time. When we see so many patients that have been impacted by this, we have to think what happened centuries ago when we didn't have vaccines. How did this start? This whole process of protecting people so they can become immune, so that they can become protected against this disease. Many times we think, okay, so there is a fire, the firemen come and they extinguish it. But there are different types of fires. We have, for example, a fire because of paper, or because there's an electronic device that didn't work. So there's a different type of things that the firemen have to use to extinguish that fire. Let's say that at a restaurant, there's a fire that happened because of hot oil. So there are different ways to extinguish the fire as well. The history of the vaccine started many years ago. The first vaccine that we have dedicated specifically to contain epidemics such as chickenpox, that's where we encounter our first character. Next slide, please. Next slide, please. Let's start with this. We start in the year of 1796. That's where Edward Jenner showed the leishers in cows to infect others who didn't have smallpox to protect them. And that is something that he observed. People who milked cows were not becoming infected by smallpox. And he associated this to, if they're working with cows and cows have different type of leishers, and it's a similar virus but not the same one, and they are protected, why don't we use those leishers and we can help other people to protect them against this disease? And this is something that became a revolution in the history of the vaccines, and that was a practice that throughout many years was applied in many countries. So people started to realize that they could prevent diseases. People didn't have to become blind or many lesions on the skin because of smallpox. Now we go to year 1879, and we're talking about Louis Pasteur. By accident, he discovered the vaccine against cholera in birds because one of his assistants in the lab went on vacation and left the cultures out. And Pasteur went to the lab after a month, and he thought, well, I have to give the shots to the little chickens. And he realized that the chickens were not sick. And he said, okay, then I'm going to use this culture that was left out in the air. And he realized that these birds were now protected against this disease. This is what we call the birth of what immunology is. Later on, Pasteur himself, inspired by these facts, began to work with a rabies virus. And he started to give injections to rabbits with this virus to protect the animals, dogs, against the virus. And there was a case where a child got rabies, and at desperate times, desperate measures, right? So he gave this vaccine to the child, the same one that was using with animals, and he saved his life. It wouldn't have happened otherwise, and he became a national hero in France, Dr. Pasteur, and that became the birth of many other projects at a worldwide level. In 1921, we were able to achieve the vaccine against tuberculosis, BCG, and it has the initials of the inventors. And this is a vaccine against a bacteria. Later on, there was another strain that was discovered that was used with yellow fever, very famous strain in our Latin American countries. We have yellow fever and we have the vaccine. And since this was seen as something that worked against yellow fever, many of the vaccines are based on this 17th strain. In 1944, a scientist by the name of Jonas Salk started the vaccine against influenza. And before that, we had another pandemic with the Spanish influenza. And in the United States, there was a big concern because we were thinking, what's going to happen to all these people? We have to provide a vaccine. And very few people were able to do this. It was tested with volunteers, and it had a high level of efficiency. And this is a version of the vaccine that we get to have every year. Years later, the polio vaccine, thanks to Albert Sabin, came about. And Jonas Salk had also a very important part of this polio vaccine, but it was the vaccine by Sabin that was able to take orally, and that was able to be taken with these little sugar cubes. That was very attractive to children because then they were able to be vaccinated easier. And then in 1986, we had two scientists, William Rutter and Pablo Valenzuela. They developed the hepatitis B vaccine, which was the first vaccine of its kind in history. It was very difficult. It took a lot of effort as a scientist in a lab, and it was revolutionary. It was different from the ones before that went through animals. This one was built in a lab, and it became very efficient against hepatitis B. And hepatitis B, along with hepatitis C, are responsible of 80% of the liver cancer. And so that became a very important vaccine. Now we go to year 2006 with Ian Fraser, Ian Zhu. They proposed the papilloma vaccine in humans. This is the one that is called as Gardasil, and then there was a new generation, Gardasil 9, that protects against many other variants of the virus. This is very important because this is something that is going to protect women against cancer. Uterus cancer that many women can contract, and this can protect women against this type of cancer. Now we arrive in 2020 with this epidemic and COVID-19, and Dr. Laila is going to explain about all the vaccines that are circulating, and she's going to explain about this.
Thank you very much. Thank you very much, Susan. Leila, I know that you're going to focus on COVID. Your introduction was very interesting because we're talking from the year 1700 until up to this date. And lately, we noticed that these processes are way more faster than they used to be in the past. So, Leila, go ahead. Good night. Thank you for having me here in this program. And after a great summary, historical summary of all the vaccines that we had, I'm going to speak to you regarding the four strategies or platforms that we currently have. As Susan mentioned earlier, the first one was a one based on inactive viruses, and that's what we knew at the time. It was complete. That introduced that virus. The complete virus is introduced in the body, and it's attenuated, and that creates an immune response. We have some vaccines that are there that have been seen that can stimulate us. The most known is the yellow fever one. For COVID, we have one in the United States. We have some of attenuated viruses. We have the Chinese one, which is called, it's been used through the Sinopharm process. Those are fraction viruses, and it's based on proteins. These are introduced into the body through organisms and enzymes of their own viruses, and that's introduced into our immune system. There's a replication on the cell at the cellular level, and that creates a response. So the little soldiers, the antibodies, get ready for war, and the peptides, that protein that we are trying to protect, that it stimulates the immune system and counterattacks. Both strategies that were least known by the people are the ones that we're seeing more often now. That's for example, the Pfizer vaccine, and those are through the RNA messenger. Those introduce some pathogen information into the body, and it's very important to highlight what the pathogen is. It's an RNA messenger that's not included. That doesn't go into our DNA. It's not going to mutate inside of us, and it takes some time in the cytoplasm, and it stays there. It never gets into the nucleus. That creates a new response. It creates a viral response, a viral protein, the one that helps us. We want our body to acknowledge and recognize those, and our body creates antibodies against those things. And the last one is the vaccine based on adenoviruses. That's the one that people knows best is for example, the AstraZeneca one is based on chimpanzees. It's been tested in chimpanzees. It's not like it has a V as in victory. Those are two adenoviruses different. The Johnson & Johnson vaccine is an adenovirus 26. These are viruses designed to transport additional genes from the pathogen, in this case from COVID, SARS, COVID-2. And the goal is to obtain a faster body response to against this virus. These four platforms are the ones that we've been using, and those platforms are not old. These have been generated lately. We've been seeing those for centuries now, but those are not very well known because some people ask, where do these things come from? Those four platforms started being studied. We started studying 181 potential vaccines. And we were able to accelerate this process because we were focused on investigation. Those 181 candidates, we picked 22 on phase one. And out of those 22, there were other numbers until we ended up with 21. And right now we have 10 vaccines that have been approved for general use throughout the world. In the United States, the Pfizer, the Moderna, and the Johnson & Johnson vaccines have been approved. And in other parts of the world, AstraZeneca has been approved by OMS, or by the OMS. We have a different one, and we also have the Sinovac and the Sinopharma, and those are part of the ones that are being used now. This gives us the tools to combat COVID-19. These vaccines stimulate our immune system, so we create antibodies. So when the virus enters the body can fight against those things. So with this short summary, I expect that these platforms are not anything new, are not strange. We've been studying those things for quite some time, and they would not cause any type of damage to our body, but they will strengthen our immune system. Laila, thank you very much. And I know that we'll come back with some other questions from the audience regarding the difference between these vaccines that you had just mentioned. As you just mentioned, these vaccines would not affect our organism. So Paulina will talk to us about the side effects of these vaccines.
Thank you very much, and good evening to our audience. I would like to start out with a distinction between the two issues regarding the safety of each one of the vaccines. I'd like to talk about secondary or side effects of the vaccine, and the other issue is adverse effects that could or could not be related to the vaccine. Regarding side effects that we may experiment, that has a lot to do with after having the vaccine, with the area where the vaccine was given could ache. There could be a burning sensation. There could be an inflammation, a headache, a general sense of feeling badly. And people think that that is the infection itself, and that is false. The reason why we have those reactions is because our immune system is reacting against the vaccine. It's doing the work that we want it to do so that it can recognize the vaccine and it can start producing what is going to be the memory if we ever find the virus, and the body will know what to do. So the profile of those side effects in regards to the vaccines, the Moderna and Pfizer vaccines, they're very similar. We're talking about that pain around the area where the shot was given, and it feels like the flu, like headache or fever. The other one that is approved in the United States is Johnson & Johnson, and they're very similar side effects. And it also happens and in a time frame of about a few days after getting the vaccine. It matters to say that each person may have a different reaction. Some people with the first dose, whether it's Moderna or Pfizer, could have a more exaggerated response. That could happen to people who have already had the infection. So the immune system is reacting to that protein that they might have already dealt with. So it's causing that response with our immune system. The other aspect in terms of safety of the vaccine could have adverse effects. And those could have something to do with the vaccine and may not have anything to do with the vaccine. You may have seen a lot of information, for example, in Europe, with there's a vaccine that has not been approved in the United States that was seen to create blood clots. That could happen in the central nervous system or in other parts of the body. It's important to realize that there are supervising studies that are going to continue to work, and it's going to evaluate if there is an adverse effect, if there is a sign or that there is going to be an event that may indicate the safety or lack of it of the vaccine. And AstraZeneca had that issue with blood clots. And in that evaluation process, we can also see how frequent those events may happen. In this case, blood clots. Let's say that if that person had never had the vaccine, what are the possibilities of that person having had that, to see if this is really because of the vaccine or it could be with the natural course of illnesses. So what happens when we vaccinate a population of high risk people older than 65 years old, for example? Because of the natural course of life, that segment of the population may have other issues like heart attacks or that have nothing to do with the vaccine. But people may think that they have something to do with the vaccine because they received the vaccine within the weeks prior to that event. So that's why we have these studies that are going to evaluate whether the vaccine is safe, and they'll be able to see if there is something that is happening with a higher level of occurrence, and things can be evaluated in regards to the vaccine. In regards to AstraZeneca, this is happening in Europe. They are evaluating all the information, and they have not been able to see evidence that these events are happening with higher frequency than they would have happened in a natural course of events. So that's why we see that there is not a higher risk in the use of the vaccine. So it shall not be suspended. So and we have these safety precautions that are a safety net, so that we are able to see what is going to happen beyond the clinical studies once we see how the general population is receiving the vaccines, because we need to know how these vaccines are going to work in the real world. And here I would like to conclude my presentation. Thank you very much.
Thank you. Thank you very much, Paulina. Excellent. And I know we're receiving more questions now. And as we said before, at the end of the presentations, we'll have some Q&A session with our panelists. We are receiving some, and this is for the Valeria. If we get vaccinated, do we still need to take precautions? Good night. Thank you very much, Edgar. Well, I'll start off with good news. The last recommendation by the CDC is that those who are completely vaccinated, if in a family, all the members of that family are vaccinated, if they go and visit a different family in which all family members have been vaccinated, they don't have to wear masks to see each other, and they can see each other wearing masks inside the house. This is the first time during this pandemic when we are allowed to do this. So this shows that first, vaccines work. Second, vaccines can help us to go back to normalcy. And third, as Susan was mentioning, vaccines are going to allow us to go and hug our grandma after our grandma is already vaccinated and after we are vaccinated ourselves. That To me, at least, it gives me hope. It gives me a feeling, a sense of a hope that there's light at the end of the tunnel. These are the good news. The rest, I'm going to say, is not bad news, but it's just an explanation of why in public places we still must use the mask and social distancing, wash our hands to avoid, meeting with large groups. And this is the explanation. First, we don't know when we're in public, we don't know who is being vaccinated and who has not been vaccinated. Second, vaccines are efficacious in 95% in the case of Pfizer and Moderna, but 95% is not 100%. So there is a tiny possibility that there's people that have been vaccinated that can still get COVID, and despite the fact that they may not be able to have a serious condition, they can still share, viral particles with other people and get other people sick. And the third part is that in the United States, we are still not at the percentage of vaccination, which is called the herd rate, meaning that 80% of the population needs to be vaccinated, which will protect the persons inside that the human herd who are not vaccinated. So because of these reasons, we must. Oh, and the final reason I was about to forget is because of the different variations. And we're going to talk about this in a few minutes. We still don't know if these different variations are going to, change in the future. So the efficacy of the vaccines against all those variations, it's unknown. So what we have to do is to minimize our risks, any type of a potential transmission of the viruses until we hit this herd immunity. So we're almost there, at least in the United States. We just need a few more months until we can reach this herd immunity, in which we'll be able to relax some of these preventing requirements. It's very important to follow the recommendations of the CDC, which change with time, and we need to keep receiving information. This is very normal. Some people, even within the health community, say, oh, CDC used to say this and others say something different. That's normal, because a year ago we did not have the information that we have today regarding COVID. So things will keep evolving, and we also have to be flexible and in the measurements, in the things that we do, the protecting requirements that we put into ourselves, and how we educate our patients. So that's all. Thank you very much, Valeria. Thank you very much. And going back to something that you just mentioned, we are learning. Paulina also mentioned that we are monitoring this, and this cannot be done unless and until we have some participants, some volunteers. And now we have Dr. Kenya. She's going to tell us why it is important for people to participate in these research matters, specifically in this Donbass program. Dr. Kenya.
Good evening. Thank you very much, Edgar, for inviting me to participate today. Like Edgar mentioned before, to participate in investigations is extremely important because it allows us to understand first why we become sick and also why we stay healthy. And that is extremely important so that we are able to advance in precision medicine. All the knowledge that all the doctors have shared with us tonight regarding the development of the vaccines, the use of genetics to advance in the developing of new vaccines, how to find cures to illnesses and prevent illnesses, all this has gone through clinical studies in the past. And thanks to participants who have wanted to cooperate and who have wanted to donate samples or answers so that investigators can advance in science, this has been possible. So today, there are many people listening to the event who may be asking themselves why their neighbor became sick with COVID 19 and didn't have a lot of symptoms, and why other people have so many complications. Maybe some of you have seen that although you've been exposed to COVID 19, people do not become sick, and other people become very ill with any virus, including COVID 19. So these are the factors that make us all unique. Every person has characteristics that influence how we react to these infections, and that is how we can study these unique factors with precision medicine or personalized medicine. That is the medicine that is based on the person as an individual, and it promises to provide us a future that in a future in which we will be able to receive medical attention, and doctors will be able to take into account DNA, environment, lifestyle, and will be able to provide you with a treatment and diagnosis that is going to be unique to you, because you, me, all of us are different. And that is the objective, for example, with this All of Us scientific program that Edgar mentioned at the beginning, was created as part of this initiative of precision medicine with the objective to advance this personalized medicine. And it's inviting a million plus people to join and to be part of this great study that wants to create the largest database and the most diverse database in history. This is a program directed by the National Institutes of Health. And like I mentioned before, DNA is one of the main factors in this precision medicine, but they also take into account other factors that influence the way that we become sick or the way that we stay healthy. During all these difficult times of the pandemic, this scientific program has joined other institutes like the Center of Prevention of Illnesses and Center of and others medical centers. All of us, this scientific program is not accepting participants only for COVID-19, but it's also a study for many different types of illnesses, but it has joined the National Health departments to support all these projects, to be able to understand what can be done to advance and to get out of this pandemic as quickly as possible. One of the things that the scientific program All of Us is doing is it started with a survey that is called Experiences of the COVID-19 Participant. And they are trying to understand the way that this pandemic has impacted the day-to-day life of the people and the effects or consequences in the mental health of the people. So All of Us is using health information found online to understand symptoms and complications of COVID-19. And also it has a very specific project with antibodies to know more about illnesses. Or for example, when a person becomes sick with COVID-19 or receives the vaccine, how the body reacts and for how long the immune response is going to work for after we receive the vaccine or we become infected. So all the knowledge that we have and that we have shared today, and all the knowledge that is being used for medical attention to be able to provide you with support, diagnosis, and treatments would not be possible if we didn't participate in this medical investigation. That's why participating in this program, All of Us, is extremely simple. The registration is open for anyone living in the US and people who are over the age of 18 or older. In order to participate, the person will have to answer a few questions. They will need to provide some biological samples and some physical measurements. You might be able to find out details about your ancestors because of your genes. But it's very important to motivate everyone who's listening today so that they can use this database that this program is creating. It is extremely valuable. It has a lot of information, very diverse information with participants from every walk of life. And you can also apply to be part of the investigations. You can not only participate donating blood or samples, you can also participate maybe to help to discover a new treatment or better vaccines in the future. And now I conclude my portion of why it is important to be part of these medical investigations.
Thank you very much, everyone. Great presentations. I do believe you have taken us into history lane and you've answered many of the questions that we received from the participants today, questions that they sent before this program, but we've received some new questions. The first one, and I believe that Susan, you can clarify some here. Historically speaking, how effective are vaccines? And the question is because some people are already asking if we cannot pick which vaccine we're receiving, and my mother received Pfizer, my brother received Moderna, and my uncle received Johnson & Johnson. So they want an answer. How effective are those are? That's a fantastic question. The efficacy of the vaccines is, who knows? We don't have smallpox in the world today. Smallpox has been eradicated thanks to vaccines. That was one of the first illnesses that was defined by the OMS as eradicated. And that's thanks to the several investigators and researchers. That's one of the reasons that's the reason that those were eradicated. And the second example is polio. And we have other examples of vaccines that are 100% effective. And there's some other vaccines that may be less effective, like 95%, for example, Pfizer and Moderna, or 85% maybe. And this is due to the different strategies that were used to create these vaccines. And for example, your next question was, if we are vaccinated, how we pick our vaccine? No, people is which one is the most efficacious, because the one I received was different than other family members. The most effective one is the one that is going to protect you against the virus. And this protection can be 95%, it could be 75%. It depends on the vaccine that you received. But if you have the possibility of being vaccinated, and if you can have that assuredness that you'll be 75% protected, why not do it? And sometimes we cannot choose because it's not on us. And then United States, I think that not even in the United States you have that option, because when we go there, it's either Pfizer or Moderna. Maybe in the future we'll be able to get a different one, but right now, as individuals, we don't have that option of picking which vaccine to get. But those two are at least 95% efficacious. One more thing that I wanted to say.
Something that I would like to add. All these vaccines have a high profile of protection against a severe reaction or hospitalization, which is the main objective of a vaccine. Because if COVID becomes a normal cold, a normal flu, we have achieved our objective. All the vaccines, AstraZeneca, Johnson & Johnson, and as well as other of the vaccines that have been used in other countries, most of them, a large percentage of these vaccines are protecting against a very bad infection and death.
Excellent, Dr. Paulina. And following up that clarification that you just made, Dr. Leila may be able to help us with this. Many people ask, how long does it take for the vaccine to take effect? The first dose protects me 80%, and the second dose to 95%. Well, how does it work?
Well,
Well,
it
it
depends.
varies.
It, the immune system has to learn, right? And when someone asks us why Johnson and Johnson is just one while the others are two, well, our immune system, well, sometimes the memory is not so good. So the first dose is to wake up the memory, and the second one is to reinforce it. Like when you have to learn a lesson at school, you had to read it once, but you didn't remember until the second time you read it. The same thing with the immune system. Also, when you are exposed, you learn that lesson, and the system is going to be able to battle it. Why? Well, it takes about 2 weeks, 10 to 14 days, for our immune system to learn the lesson. So that is why we say that between the first and the second dose, that is for Pfizer and Moderna in the United States, or AstraZeneca, or Sputnik in other places, it is necessary for us to continue to use the masks, social distancing, wash our hands often, because we can still contract it because our immune system does not know the lesson 100%. Once we are completely vaccinated, 2 weeks later, after we're vaccinated completely. Like the doctor said, once the whole family has been vaccinated, now you can remove the masks, you can have dinner with everyone, just like I did with my family. Um, this weekend, thank God, we're all vaccinated.
Excellent. We just received a question from Houston. What happens if I cannot get that second dose? I forgot about the appointment. What do I do? Generally, we would like this to happen as soon as possible. We don't want people to wait for 6 months, but there's been some studies to expand that period of time. For example, AstraZeneca has a 12-week period of time. The other vaccines can take 6 to 8 weeks, but it's very important to get the second dose so your immune system will learn the lesson very well. We do the same with other vaccines, hepatitis A and B. We do that very often. So that's very important. Perfect. Dr. Laila, thank you very much. I think that this question, maybe Dr. Paulina can help us with that. There are several families with kids, little kids, and some pregnant women. Question is are the vaccines safe for those mothers who are feeding their babies?
What we have seen, what we know about COVID and the way that it impacts pregnant women, being pregnant by itself, that becomes at risk population. What we have seen with the studies for Moderna and Pfizer, the studies were not focused on pregnant women, but there were pregnant women during the research and during the clinical studies. And all those pregnancies came to term without any complications. There was one issue with one of those pregnancies, but it happened in the placebo group, which is the group that did not receive the vaccine. So everything that we've seen in the clinical studies and with all the health professionals in the United States is that all the women who are pregnant and became vaccinated, we have not seen any signs that could create concern regarding their safety. And this is something that the woman needs to talk, and this is something that needs to be addressed with her OBGYN. But there's no reason to exclude pregnant women in terms of the vaccine. And Edgar, you were talking about breastfeeding. And during the breastfeeding period, we've seen good results. And the results that we've seen after the clinical studies is that the antibodies are transferred with the breast milk. And that is something that is going to help protect the baby. And that's also part of those good news. Beyond the protection that the mother is receiving, there's also a transferring of those antibodies given to the baby.
Excellent. Thank you very much, Dr. Paulina. The next question that we just received is about the side effects. And many people say, oh, I've heard that the first dose does not have big or extreme side effects, but the second one, yes. So why is it that some people have different side effects than others?
Like I mentioned before, each individual is different. Each body is going to react differently. An important distinction has to do with age and the immune response. As we age, our immune response, all the organs, all the cells also age. And that's why we've seen that people older than 65 have effects after the vaccination. Um, and it's not because the vaccine is not working as well, but it's because their immune system or the defense system maybe it's a little slower or it's not as strong as how it could happen with younger people. So we may see discrepancies between young people and older people. Younger, they could maybe young people could have that fever, that headache, and not so much older people. In terms of the response between the first and the second dose, a lot of it has to do with what Dr. Laila was mentioning, whether the body received that first lesson and now we have the second lesson. There's information that indicates that people who had SARS-CoV-2, that means that they had the infection with the virus that causes COVID, when they receive the first dose, they have a more exaggerated response. Why? Because they've had their first lesson when they had COVID, and the reinforcement was with the first doses. So people who have never had the virus, the first lesson is the first vaccine, and the second lesson is the second dose. So that varies from person to person, varies according to age and other illnesses that the person may have, that it's impacting the immune system. And that could create a different response to it.
Thank you very much, Dr. Paulina. Dr. Valeria, you may be able to help us with the next question is people are listening regarding new variations, the one that comes from England or South Africa or Brazil. How do this work? Do the vaccines that we currently have would help us with that? What can we tell the audience about this? So many viruses, especially the RNA viruses like coronavirus, the more they reproduce themselves and the more mistakes they make on that reproduction, those mistakes are called mutations. When a virus acquires a certain amount of variations and mutations, it's going to change its own functioning. For example, it can be more aggressive, it can be transmitted more easily, it may cause more serious conditions. Those are the variations. Variations are types of coronaviruses that have acquired a certain amount of mutations that will confer upon it a different capacity to being compared to the original virus. For example, the ones that are most known by the people, the ones that have been identified are the three ones that you just mentioned. Edgar, first, the England variation, the South Africa variation, and the Brazil variation, which is the P1. In the United States, those three variations have been identified. The one that's been identified more often is the one from England, and then second place, the one from South Africa, and the third place, the one from Brazil. Most of these vaccines have an efficacy a little lower to this with these variations than the one that they had to the original variations. For example, the AstraZeneca vaccine, which is very efficacious regarding the original virus, it's not working at all with the South Africa strain. It gives some protection against the United Kingdom strain, and we still don't have data regarding its protection against the Brazil strain. But despite the fact that the efficacy of the other vaccines like Johnson & Johnson, Pfizer, and Moderna, the efficacy can be lower against these new strains, we haven't seen any changes on their protection that they provide against, serious COVID, like Paulina just told us. They still offer a good coverage and protection against the serious condition, meaning that COVID people that acquire COVID may end up hospitalized and even deceased. For example, at this time, it is very important to be vaccinated, despite of the fact that we know that there's some new strains. Why? Because the more people get vaccinated, the less possibilities for these strains to become predominant within the population. So the time to be vaccinated is now. Despite the fact that these strains do exist in the United States, those are not yet predominant. The original strain is the one that is circulating in the country, and these may change in the future, but we can avoid this from happening the sooner we get vaccinated. Thank you very much, Dr. Valeria. We still have 5 minutes, and there's two questions from the audience that they would like to get answers from you guys. This question is for Dr. Kenya. You mentioned before how important it is to follow up. How do we know how well these vaccines are working?
That is an excellent question. Thank you so much. The development of the vaccines happened during clinical studies at different phases, in which the efficiency and the safety of the vaccine is put to the test. Once the vaccine is approved to be able to use in the population, a lot of people think that the clinical studies now they do not continue or they stop. In actuality, after that is being used in the population, many of these studies continue to know more about adverse effects that might not have been detected at the very first phases of the studies, and to know more about the immune system. So once we're exposed to the vaccine, the body develops antibodies that are proteins that are going to protect us against a future infection of COVID-19. There are other studies that are focused on how those antibodies, how they are reacting to the vaccine, and how people develop an immune system very strong against the virus, while other people after the vaccine do not have the same response. This depends on many other factors that the doctors have mentioned: medical conditions, genetic conditions, and others. And to answer this question, the clinical studies of the vaccines happen in many phases, and they continue even after the person receives the vaccine. Thank you so
Thank
much,
you
Dr.
very
Kenya. We have only
much,
1 minute.
Dr. Kenya. And HIV, lupus, and other illnesses, are those vaccines safe for them? What we have
What we
seen
have
so
seen,
far is that
let's say that the participants all have lupus or all of them have HIV. What we have seen is that those people who had HIV and what could happen, and the way that we're thinking and in how these vaccines may impact people who have lupus or who are taking prednisone or something that reduces the immune system. Maybe they may not have as good a response as someone who does not have that condition. We're not talking about safety. We are talking about maybe that the response is not going to be as effective as someone who does not have those conditions. There are other studies that are evaluating that, like the doctor was mentioning. all that surveillance that happens afterwards. We have to see how the vaccines are working in the real world and how they are impacting people who have those conditions. Those are conversations that the people need to have with their doctors and with people who have HIV and other people who have immune system related illnesses. Those are populations that have a higher risk, right, in regards to COVID. So what we have seen in regard to the vaccine is that they're safe and that they can prevent and further illness.
Thank you very much. Thank you very much. Unfortunately, we don't have time. I know that we can stay here for 1 more hour at least answering these questions as part of this very interesting conversation. The idea for tonight's event is to help people make educated decisions so they know at least the ABC of these things. And I would like to ask each one of you a final message for our audience tonight. Keep wearing your masks while in public. Social distancing. Dr. Paulina, to vaccinate for yourselves, but also for your community. Dr. Yeah. There's hope. Moving.
Join all of us in the scientific program so that you can all join in the research and cooperate. Thank you so much to all of you for joining us tonight. I want to thank all of you and all the information that you provided to the community. Thank you to all of us for supporting the event. The future of our health starts with all of you. Please go to the website in Spanish, and we want to also thank all the centers that supported us, the University of Kansas and the Consortium of New York, included in those. Remember to go to your closest public library. And before you leave, please take a moment to fill out a survey. Your opinion is very important to us, and we need your help to continue to bring these kinds of programs to teach our community. Thank you, and have a good night.